Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Dr. Denise, good to see you. Good morning. How is London? I hope not too cold.
Good morning. How are you?
Very well. All right. So today, you're going to be talking about the role of oncology nurse in the management of cancer. We yield the floor to you now, and we'll have our own interventions as the program continues.
Thank you. Good morning, viewers, and welcome to today's edition of the Cancer Awareness Campaign that is partnered with AIT and Cornwall Cancer Foundation. Today, I'd like to firstly thank our two specialist nurses. One is a nurse practitioner, and the other one is an oncology nurse who will be talking to us about the different roles that the nurses play in the lives of cancer patients and the impact they have on our everyday life. So, firstly, I'm going to be starting. Welcome, ladies. Welcome, Mrs. Fashionmore, and welcome, Mrs. Susan.
Thank you for joining
us. So let's go. Let's go quickly. Let me now start moving. So, who am I going first with? First question goes to Mrs. Fashionmore. Let's start with you. So tell us, because I think that will help us to put everything in context. Yeah, we good? Okay. So can you quickly tell us what exactly, or can you tell us what exactly is the role of a nurse practitioner, and what exactly is a nurse practitioner, and then what is their role? So we assume that all nurses are nurses, but apparently there is some difference.
Yes, thank you. Thank you for this opportunity and the privilege. A nurse practitioner is a trained specialist nurse who have undertaken some medical education and is able to provide advanced nursing care. Nurse practitioners are not nurse specialists. They are not clinical nurse specialists like oncology nurses or respiratory nurses or any other area. What nurse practitioners are autonomous practitioners, and that makes it possible for us to assess patients, examine patients, diagnose, and then treat. So we can solely make decisions with regards to patients' care without consulting. But along the line, we've got the doctors around us to give the support we need. So we are more like generally based, like general practitioners when it comes to nursing. We are not doctors, and we are not replacement for clinical specialist nurse, but we'll work along with nurses. Most GP practices now in UK have nurse practitioners, and this has helped to take a lot of burden off the frontline doctors. And so that is our role. Some of the time we may be the first point of call for cancer patients, because when they come to the hospital is they are unwell, they've got symptoms, it has not been diagnosed, and then from my discussion and consultation, it's been picked up. And sometimes when this happens, we just have to connect and refer them to the doctors who will do some other works with them. So that is the difference. And when it comes to parading of cancer patient as to regards to their treatments, and the role we can take is also involves the assessment, the diagnosis, and the treatment. But when we don't solely take this on board when it comes to the treatment, we work along in a multidisciplinary team. So that is who we are. And the role of nursing practitioner is evolving. The World Health Organization in the year 2020 consulted with about 78 countries and found that a lot are taking on board. I don't know if that is happening back in Nigeria. They're taking on board the role of, they are taking on board a lot of nurse practitioners to come in and to do a lot of work. We as nurse practitioners along the line, when we come into contact with cancer patient after being diagnosed or along the line of diagnosis, investigations, tests, we are on board with them. Some of the examples of some of our work is we are involved in the screening. For example, in smear tests, we take the samples. When it comes to diagnosis of cervical cancer, we are involved as nurses. And sometimes it may just be education along the line for people to just live a good lifestyle in order to avoid developing symptom of cancer. So we do give advice on living a good health lifestyle. Sometimes it's to do with referral and connecting people that have already been diagnosed with cancer with other services, maybe with nutritionists, maybe even with other cancer services. Like here in UK, we've got the Macmillan nurses, we've got the Marie Curie. So because they are more specialized along that line, we may have to refer, and we do that from time to time. Recently, because of COVID, there's issue of impact of COVID on the cancer services, which is very great even here in UK. So there are some other things to be introduced, like nurse-led clinics, just to be able to have a point of call so that we will not miss out on diagnosis of cancer patients. So this is part of what we have been involved with, and the role of nurse practitioner cannot be underrated as to the nursing care of patients with cancer. Thank you.
Thank you. That was quite detailed. So I presume there will be some differences between the two of you now. Now, Susan, how are you? Good morning. Welcome.
Good morning.
Over to you now. I think I would say it's the same question. Who is the oncology nurse, and what is their role in the cancer care of a patient?
Good morning, and thanks for having me today. Good morning to you, viewers. The oncology nurse, first of all, oncology nursing is one of the numerous specialties in nursing profession. And so the oncology nurse is one who is specialized. He or she must have undergone some series of specialty training in oncology. And unquote, oncology nurse must have a passion to care for the cancer patients. So the person has to go through some certain training to be able to qualify he or her to work as an oncology nurse in any oncology center. That person, like I said, must have passion for cancer patients. Oncology nursing goes across patients, to their relatives, to families, to friends, even to the society. Oncology nursing gets up to the extent of meeting the needs of the patients from before diagnosis. Oncology nursing goes from before diagnosis to treatments, and is a continuum. It can't be exhausted. We take care of these patients from before diagnosis till after treatment, even after life in some cases. At that end of life care, we give supportive care until after end of life. We go as far as taking care of the families, taking care of the relatives. Oncology nursing is a process, is a continuum. It doesn't have limits. And so oncology nurses also go ahead in form of sensitizing people to go into, screenings, early detection, and encouraging people to come on board, come and present yourself. I know that there are so many things involved, so many challenges, but we encourage people to come on board. We encourage people to come for treatments and other things that are the other things that follows will come on. Now, Oncology nursing gives the kind of supportive measures that no areas of nursing can give. Because we as oncology nurses deal with the patient's physical, the patient's emotional, and the patient's psychological care. We don't just go and, treat the surface. We go as deep as dealing with patients psychologically, emotionally, physically, and down to the spiritual aspect of the patient's life.
Thank you. Wow. One of the things I'm picking up from both sides is that they are interwoven in your general rules. So I'm going to say, okay, let's look at it from this perspective. Now, this is Susan. This is still with you. And can you just give me in like 3 sentences, in your own experience, what is the major challenge, or give me 3 of your major challenges that you face in your care in Nigeria, specific to Nigeria?
Okay. Oncology nursing can be very challenging and demanding. First of all, helping patients to cope with diagnosis from beginning. You have to be there. You have to give them psychological support. Some patients, because of fear, at the point of diagnosis, can just give up. But we have to be there to support them psychologically. And secondly, during the treatment process, we are there to encourage and to help them relieve them from so many numerous symptoms of treatment. And after that, the maze of navigation, navigating through the maze of the hospital is another challenge that we pass through. So some patients don't know where to go to. They don't know how to go about it. They don't know what to do because they are confused, because they are emotionally stressed out. So we have to be there to direct them, to guide them through the maze of the hospital, of the treatment, where to go to at the right time, what to do at the right time. Some of them even call you at the middle of the night, asking so many questions. So these are the challenges we have. You must be there for them. You must be there for them. You must make out time for them. Even if they call you at the middle of the night, you have to pick as an oncology nurse. Thank you.
Thank you. Okay, there's one key thing that's very important, and it's something that I've had to navigate my way through, and it's always quite challenging. And it's to do with the stigmatization that is associated with cancer patients. Unfortunately, I use the word stigmatization because it's a fact. However, I wish it wasn't. So I'm going to put this to you, and I want 2 different perspectives. So I'm going to say, Sister, let me put it this way. Okay, I'm going to read you a sentence. So the stigmatization against health workers, the stigmatization in cancer care is so saddening and heartbreaking, and are often pushed to the back of the minds and treatments of cancer patients. And there's no need for it because the stress levels that a cancer patient goes through is quite challenging. So in your experience, and I'm going to ask you specifically for one point, Ms. Fashion, can you give me one point? What is your experience and how? So one-on-one, how was your experience and how do you, how would you recommend navigating through this?
You mean, just to clarify, with stigmatization, yeah?
Yes.
Right. From my point of view, I won't even call it stigmatization. I will look at it personally as ignorance on the part of that's the way I look at it, on the part of the healthcare personnel. And not all healthcare workers look at it this way. It does occur, and it's a shame. But with the change in things and a lot of awareness, things are moving on and moving forward. When I was a newly qualified nurse over 25 years ago, we don't talk much about cancer, to tell you the truth. I don't even know, even though I was qualified, trained for 3 years, I don't know much about cancer. So to even look after a patient with cancer, I wouldn't be able to do it. But as time evolves, there's a lot of awareness now for us to know that it is not a death sentence. And even nurses are beginning to getting more to know that there is more in cancer than just thinking that is the end of it. People live with cancer. People don't necessarily have to die with cancer. And if eventually you have to die, you die with dignity. So it's ignorance on the part of the nurses that are thinking that is the way it is. But because of the changing in things, here in UK, we've got a lot of information that is available to us. And we've got what we call continued development program. And that is training on board from time to time, just to equip you and to inform you as to what you need to do. And then we've got people that are in charge of this kind of training and in charge of healthcare setting. We call them CQC. And they are the one that if you don't practice to the fullness and to the protocol and to the pathway that is set up, then you have something to answer to. So we have to answer to them. So I believe things will change. And we have pathways that makes it now, unlike before, easy for you not to be able to put cancer patient behind as if, okay, because they are terminal and they are patients that may eventually, and I'm using may eventually, because treatments are changing, development and technology are improving mortality rate. We've got a pathway for cancer patients in different things which does not exist before. And so this has helped. And this is one thing I will recommend as to way forward in the care of cancer patients, to follow pathways and protocol and create more awareness. Like the program we have, where I'm on now, thank God for it, it does not exist many years ago. And this kind of program is creating awareness.
Okay, thank you very much. I'm going to ask you, Susan, can you answer this question for me? I will come back. There's some questions I'll go back to which are short and sweet. But if we try to be specific, then I think I may get more questions in. So now your question. In Nigeria, oftentimes there's the health care workers, especially nurses, who go around whispering to patients to not take chemo or most forms of cancer treatment, right? And the project that personally yet non-scientific views on patients, making it harder. Because, okay, what I'm trying to say is that these discussions that are being shared with the patients are not scientific based. Is that clearer? They're not science based, so they're just people views, and we already live in it's not my portion, and we already live in all the things that are not correct, and what did you do wrong? So you get what I'm coming from. Yes?
Yeah.
Okay, so what is your take? What do you think about this, and what would you say to patients who find themselves stuck between the science and the treatment, the science and the is it religion? Is it is it ignorance? I don't know. But can you give me like two main points, because time will run out of us and if we don't finish. So please, two key things that we have to address this one, please.
Thank you. It's quite unfortunate that such things happen around the health sector. Knowing the fact that cancer is the ratio of cancer is like 2 to 1. Nurses and health practitioners, if there are some nurses that do that, is really a sign of ignorance on their own part, because they, as healthcare practitioners, should know more than any other person that cancer is no respecter of man. And so taking these patients to the back to whispering to these patients and telling them not to take their treatment is evil. I need to let the patients know that, or people passing through this kind of situation, or people that have found themselves in this kind of situation, that there is need to go for treatment. I've had so many cases that people, because of the side whisperers that they shouldn't go for their treatment, and at the end of the day, they come back with late diseases. And we've been trying to sensitize them, to let them know, talk to people around you. If they find out something, they shouldn't listen to side talk. They should come to the hospital. And this calls for a need for government to do something about expanding the oncology center, especially in my center. The oncology center needs to be expanded, both in manpower and in facilities. This will help aid people to come more. And then talking about the nurses, we need to sensitize them to stop doing this. This happens to even healthcare practitioners that fall victim of being a cancer patient. It's not like a victim though, but that's in one way or the other has cancer. They will remain until at the end stage. You see them coming to the oncology center, which is not right. And it's not something that you can overrule cancer in all aspects. It doesn't have limits.
Not a respecter of persons.
It's not a respecter of person. No matter your race, no matter your tribe, no matter your status, it doesn't have a limit. So people should be aware that cancer is something that is evolving and that we need to tackle this thing, especially in developing countries like Nigeria. We need to tackle it as quick as possible, starting from the healthcare professionals.
Thank you. Thank you for bringing that up. But I agree with you. I just always like to, maybe because I sit on the chair, so I know what we're feeling. So I would really appreciate that comment you made at the end, that, you know what, anybody that's going through cancer, please just speak to people. Cancer is not a respecter of persons. Mrs. Fasher, well, in your experience, and I'm trying to get as many questions in, and time will soon throw me off. So let me keep going. In your experience, in your practice, what's your experience like with your patients suspected to have new diagnosis? So I know that you are coming from the UK angle, but generally, in your experience, what would you say are the experiences of new diagnosis?
Thank you very much. With regards to patients that are newly diagnosed with cancer, they come in and it's like they come because of the symptoms they are having. And so they come in for consultation and they come in and tell what is going on with them because they're already diagnosed. But I found out that some of them are very anxious and they've got adverse emotional issues. Some come in very tearful, some come in with low moods, low self-esteem. And you wonder if they're newly diagnosed, and some come in with denial, self-denial. They can't accept it yet that they have cancer. So that I've witnessed, and some will tell when you sit down with them and you're discussing the symptom that they have, they've already been diagnosed with whatever kind of cancer they are. Some are still going through different investigations and tests in order to identify what state and what is going on. But it is very hard and difficult, and it's mostly mentally that it comes on board with it. Some actually, I've experienced one that told me, I wish I had lived life better. Like blaming self. I wish I had done things in a different format than the way maybe it wouldn't have occurred. So these are the kind of things I have experienced with patients. And what we can do, what I have done in some cases is just to empathize, sit down, sometimes just listen, that they know. They need the patient with cancer. They need somebody to talk to. And sometimes by the time they leave, they are more relieved. I found that some patients coming, reattending the hospital because every symptom of everything they feel, they want to come back because they're telling me they're scared of the unknown. They don't know what's going to happen. They've got family, they've got children. Well, how are they going to tell their children? And all we can relieve from the information, from the knowledge, and we have is to tell them the fact that you've been diagnosed is not death sentence. It's not the end of it all. There is life even with this. You can live with cancer. People are living with cancer, and people have overcome cancer. We've seen it a lot happening with cancer. And you can still have a good life even though you are diagnosed with cancer. So that's part of my experience. And it is worse with patients that are, that are suspected to be having cancer, not just diagnosed, that already diagnosed, that have been investigated and undergoing tests that query it may be cancer. That is the one that it is very hard for me as nurse practitioner to deal with, because they come with different questions. They come with, what have I done? They come with, what can be done? They come with, how can this be evaded, that it will not happen? And what do you have to tell such a? All you do is to say, let's wait till the outcome of the test and everything. So mostly it's emotional and mental support that they need. Sometimes I may have to connect them with referrals to counselors just for them to have somebody to talk to, or even refer back to their GP because they're under stress, so that they can be helped.
Thank you. Wow. You guys seem to have covered quite a lot in this field, because you've been able to address their mental health, you've been able to address their concerns, their anxieties. I use the word there because of where I'm sitting, but actually I get this. It's just so real. It's yeah. So let me ask Susan one question. Susan, do you feel your work is rewarding? Quick or not long. Do you feel it's rewarding? Just a very quick one.
Being able to talk to patients, being able to convince them to go through treatment, being able to support them through the triage of treatment and the maze of the hospital, being able to support them even at the point of dying, even if they die, letting them die with dignity and die with happiness. It's enough reward for me as an oncology nurse. I know the field is challenging, but that alone gives me joy.
Thank you very much. I want to thank everyone for joining us today as we continue our discussion on the Cancer Awareness Campaign. Thank you to both our guests, Mrs. Nasogbo and Susan. Thank you. God bless both of you. And I want to say thank you very much to AIT for your continued support in driving our cancer awareness campaign across Nigeria. And to those who need help, you can find us on Common Cancer Foundation on any of our platforms. Thank you, and over to you. Thank you, guys.
Thank you so much, Dr.
Thank you.
Yeah.
Thank you.
Thank you so much, Dr. Denise Ajo and your team. Have a wonderful day. Interesting awareness issues you just brought up again as usual today. Have a wonderful time.
Bye.